Picture this. You swing your legs out of bed, and your ankles feel glued in place. What if that sticky moment is actually a clue, guiding you toward the right fix for your joints?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, joined by Lara, Skye. Today we'll help you decode whether your discomfort is osteoarthritis or rheumatoid arthritis, and what specific steps, drawn straight from Dr. Mercola's article, you can take right away.
Thanks, Ethan. By the end of this conversation, you'll know which symptoms signal mechanical wear, which suggest an immune misfire, and how targeted nutrition plus mitochondrial support can calm the fire before lasting damage sets in.
Let's start with definitions. Osteoarthritis is cartilage breakdown that unfolds over decades, mainly in weight-bearing joints. Rheumatoid arthritis is your immune system mistakenly attacking joint linings, and it can accelerate in mere weeks.
That pace difference matters. Osteoarthritis usually appears after age 60 and ambles forward. Rheumatoid arthritis often shows up between 30 and 60 and can flare so quickly that healthy joints feel swollen overnight.
Where it strikes offers more hints. Osteoarthritis prefers knees, hips, spine, and thumbs, often on one side first. Rheumatoid arthritis almost always starts in your hands, wrists, or feet, and it mirrors itself, hitting both sides together.
Systemic signs further separate them. If joint pain arrives with fatigue, mild fever, or appetite loss, your immune network is involved, steering the diagnosis toward rheumatoid arthritis. Osteoarthritis, by contrast, stays mostly local.
Morning stiffness is a quick home test. Rheumatoid stiffness can lock you up for more than an hour after waking. Osteoarthritis stiffness loosens inside 60 minutes and then resurfaces after long sitting or standing.
Imaging tools can mislead, especially early on. X-rays may look normal even when osteoarthritis has already started scraping cartilage. Conversely, you can have glaring degeneration on scans, yet feel only mild discomfort. Your experience is the better compass.
Age and body weight combine like a vice on osteoprone joints. 1/3 of adults over 75 have osteoarthritis, and every extra pound adds 4 pounds of force on your knees. Losing 10 pounds removes 40 pounds of pressure every step.
Genes carry weight too, particularly for hand joints. If parents or siblings developed prominent knuckles or drifting thumb joints, your odds rise sharply. Add past injuries or repetitive motion, and cartilage risks compound.
Rheumatoid arthritis, meanwhile, hinges on immune regulation. When mitochondria falter, they produce less superoxide, lowering IL-10, your built-in off switch for inflammation. Restoring mitochondrial health helps your immune cells calm down.
Now let's walk through 5 natural strategies, each one anchored in Dr. Mercola's recommendations that address root causes rather than masking pain. First, eliminate vegetable oils loaded with linoleic acid. Soybean, canola, corn, safflower, sunflower.
Swap those out for stable fats like grass-fed butter, ghee, or beef tallow. Cutting linoleic acid tamps down oxidative stress that otherwise keeps joints swollen, whether the damage is mechanical or autoimmune.
Second, boost vitamin K2. Aim for 180 to 200 micrograms of MK7 daily, or pack your meals with grass-fed egg yolks, aged cheeses, and fermented foods such as natto or homemade sauerkraut. K2 blocks cartilage cell death and deters calcium deposits.
Third, sip genuine bone broth. Slow simmer grass-fed bones, especially cartilage-rich pieces like chicken feet, to release collagen, glycine, glucosamine, and chondroitin. Those molecules rebuild connective tissue and soothe inflammatory pathways.
Fourth, shed surplus weight if you're carrying more than your frame supports. Pair a daily walk with sunlight exposure and ditching linoleic acid. Even modest loss multiplies relief because joint load drops exponentially.
Fifth, nurture your mitochondria. Eat fiber-rich fruit to raise butyrate. Move frequently, bask in morning light, and steer clear of vegetable oils. Balanced mitochondria generate signals that nudge your immune system back into rest mode.
Some people with rheumatoid arthritis also explore dimethyl sulfoxide, or DMSO. Research cited by Dr. Mercola shows it can improve joint flexibility 20 to 30 degrees without relapse, worth discussing with a knowledgeable practitioner.
Let's revisit diagnostic red flags. Symmetrical swelling in wrists or fingers, fatigue and stiffness lasting beyond an hour, all point toward rheumatoid arthritis. That pattern demands prompt evaluation, so long-term erosion can be slowed.
In osteoarthritis, watch for pain concentrated in a single knee or hip, stiffness easing with movement, and gradual shape changes like enlarged knuckles. Early lifestyle shifts often stall progression before replacement surgery looms.
It's crucial to recognize that osteoarthritis isn't just wear and tear. It's a whole joint disease involving cartilage, bone, ligaments, and synovial lining. Accepting it as inevitable aging delays action and invites deeper disability.
Equally, rheumatoid arthritis isn't just painful joints. Unchecked, it can harm organs and erode bone. That's why supporting immune balance through mitochondrial care and cutting inflammatory oils goes beyond symptom relief. It protects total health.
Movement is medicine for both conditions. Regular, low-impact exercise lubricates joints, strengthens stabilizing muscles, and often beats pills in reducing pain, all with positive side effects like better mood and metabolic health.
Another consideration is that scans and labs are tools, not verdicts. If your joints hurt, act on the signals you feel rather than waiting for imaging to prove something is wrong. Early intervention preserves more function.
And remember, cartilage has limited blood supply, so nutrients like K2 and collagen reach it slowly. Consistent daily intake matters more than occasional bursts. Make broth and fermented foods staples, not seasonal experiments.
Likewise, mitochondrial renewal is gradual. Daily walks, sunlight, and fiber keep energy factories humming. Skip a week, and benefits fade. Think of mitochondrial care as ongoing hygiene rather than a quick fix.
One more myth to tackle. Exercise isn't dangerous for arthritic joints. Appropriate movement actually strengthens the surrounding muscles, reducing microscopic shearing inside the joint. Rest without rehab often worsens stiffness and weakens support tissues.
If you're unsure where to start, gentle water walking or cycling provides motion without overloading weight-bearing joints. Progress toward resistance bands or bodyweight squats as comfort improves. Consistency outranks intensity.
Ready for action? Identify one food today that contains vegetable oil, maybe store-bought mayo or snack chips, and replace it with a serving of K2-rich aged cheese. Then take a 10-minute post-meal walk to lubricate your joints and ignite mitochondrial recovery.
Repeat that tiny loop. Swap the oil, walk the walk, at every lunch for the coming week. You'll slash inflammatory triggers, feed cartilage, and reinforce the lifestyle patterns that keep joints resilient.
Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.